ongoing meeting space out there, again, for after-school programs or maybe parent education programs. You can go to libraries. Many of the apartment buildings have community rooms. Just think beyond having the traditional meeting in the school. Partner with families. I cannot emphasize this enough, that these parents are incredible people. One of the greatest honors I've had is working with these immigrant parents in the classes that I've been able to lead. They have such great insights, and they have such extraordinary experiences, and you need to provide them with the opportunity to share these in a place where they can be a little vulnerable, where they're going to be supported, asked in a respectful way, and the knowledge and the expertise you'll get back is really amazing. And then make sure you've provided opportunities for them to share the expertise that they bring into the room. Help them navigate the system. They are indeed working with their students at home. They do care about the school, but they don't really know how the school operates. They don't know how to access services at the school. They don't know what's available in the community. And this is where, not just talking at them, but finding out what it is they need and sharing with them knowledge about how to help their child choose classes, what to do if their child is having a problem. These are the kinds of things they need to move forward. Discuss these strategies together to care for students and the families themselves. But don't make it, again, this one-way dialogue. Only from a two-way dialogue will you hear what's going on and learn from that. There is an article posted on the Caring Across Communities website about building these partnerships with immigrant parents that I co-authored for educational leadership. So you can get more about this idea of how to partner with these parents there. But the critical piece here is it cannot be one way, or it doesn't support the students. So let's then move on to this issue of supporting the mental health of students. As we've talked about here, you need to break down the stigma that is associated with it. And there's a couple of ways to do that. First of all, of course, if you're building this relationship of trust, the families will trust you. And you need to get away from using words like mental health or mental illness and really talk more about the specific issues. Focus on the continuum of support for the child. Yes, your teacher's there to support the child academically, and the guidance counselor's here to help the child in another way, or maybe another mental health provider. It's all part of the same system, as opposed to the parent feeling, okay, the child's here for school to work with the teacher, but who's this other person here, and why should I entrust my child? Work with the cultural brokers in the community so that you understand how to present this in a culturally competent way. Excuse me. Okay, also recognize that the entire family has stress and is going through trauma. Excuse me. And again, you're working on serving the entire community, the entire family. If you only work with the students, then you're missing out on what's going on for the family, and it will be of limited success. You need to make sure the entire family is here. Develop the collaboration between teachers and your mental health professionals. Make sure you're sharing insights. There is that whole issue of privacy again about student information, but there are certainly ways to talk about this among the professionals in the room. And develop these strategies along with the families. Again, you don't want to leave the families out. They bring great expertise, so while the professionals can discuss it, you want to make sure the families are part of it too. And lastly, use culturally responsive screening and assessment. There is an excellent issue brief on this on the Caring Across Communities website, so I hope you will go to it and see that this is also helpful. I wanted to give you an example of the way that you can create a system where teachers will trying to get to my next slide here, where the teachers can support the student. Here we go. This is a chart from New York University program called Bridges that's part of Caring Across Communities. And you can go to the Caring Across Communities website and you can see this, that they've got quite a bit of information posted under the NYU program. Obviously, you're not going to want all this information here right now, but to just see that you can, a teacher in a classroom can take a number of different paths depending upon the behavior of the student in there. But what we want to emphasize is that it's critical at each one of these stages that you talk to and involve the families. Use them as a resource. Make sure that you're utilizing their expertise. Now, the Bridges program at NYU has an absolutely wonderful parent engagement part of it, so I'm sure that they're doing it even if it's not part of this chart. But I just want to reinforce that as you're going through this sort of analysis, make sure that the expertise of the family is part of it. There are additional resources on the Caring Across Communities website. This is you'll get more information about this link, but there is the link to the website. There's information on the projects. There's additional resources. And then, as Donna Behrens had mentioned earlier, there is a blog to raise additional questions. I'm going to get to a couple of questions, but recognize that this blog will be going on for a couple of weeks where I'm going to be coming in and answering additional questions. So be sure to go to that and ask your questions and look at the questions posed by others. There's also a new issue brief on this topic coming, so that's something to be looking forward to, and we'll let you know about that. And at this moment, I'm going to pass it back to Donna Behrens.
Great. Thank you so much, Eileen. Eileen's going to take a look at some of the questions that you've been posting as this presentation's been going on, and she will take a few minutes and get to some of them. In the meantime, as she said, we do have a blog. We are going to take the questions people have posted, and we are going to begin answering some of the questions, and feel free to also go and to our website, and this is a camera shot of the Center for Health and Healthcare in Schools, Immigrant and Refugee Caring Across Communities. And as you can see on the camera shot, there is a lot of resources on here, and we really want to encourage you to take advantage of the resources we have put together on meeting the needs of our immigrant and refugee students and their families through school-connected programs. So again, this is a camera shot of the Portland Public School Multilingual and Multicultural Center, and it is a link from our website. This is the homepage of the Immigrant and Refugee. As you can see, Caring Across Communities, tools and documents, and additional resources are listed. And finally, Eileen had mentioned our issue brief, Screening and Assessing Immigrant and Refugee Youth in School-Based Mental Health Programs. So we encourage you to take advantage of what we have on our website, and also to take advantage of our blog and the fact that Eileen will make herself available to answer any of your questions. There was one question that came up frequently while the presentation was going on. Many of you wanted to know about accessing, printing, or downloading Eileen's presentation.